we'll move on. Suresh. Dr. Suresh was until recently working for World Sakra Hospital, Sakra World Hospital. Right now he's HOD of Lab Services at Elbit Medical Diagnostics, Bengaluru. Now he's going to talk on how to manage successful POCT program. Dr. Suresh.
Thank you, sir. Good morning, everybody. At the outset, I would like to thank Dr. C.V. Anand, my professor and mentor, and also Dr. Venkatesh Thuppil for giving me an opportunity. So I'll be speaking on managing a successful POCT program. Point of care testing. So the planner for 15 minutes is, so I'll just discuss what is a POCT, then what is an ideal POCT program, then what is a successful POCT program, and managing a successful POCT program. So point of care testing defined by ISO 22870-2006. As per this, that any testing which is carried out at or near the patient or the patient where they are located, the testing system itself will be brought to the vicinity of the patient, and you can see the last with the result leading to possible change in the care of the patient. So these two definitions are used in this ISO 22870-2006, and it is also there in our ISO 15189-2012 definition 3.1. And College of American Pathologists have added further that the tests that do not require permanent dedicated space, unlike conventional laboratory or core laboratory, then that are performed outside the physical facilities of the clinical laboratories. So this is the point of care testing definition. So if we just have a revamp of the history of POCT, it started in 1950s with the introduction of urine dipsticks, which was made commercially available for the first time. Later on, we had urine Combur test strips in 1964. Then 65, the first dextrose sticks for the glucose testing was evolved. And we also had a reflectance meter in 1970. This was the first glucometer in the history. The same dextrose sticks were used. And in 1990, of course, all the conventional glucometers using biosensors, the methodology is converting the biochemical reactions into electrical signals. And if we go through the spectrum of patient care testing, so here we have 4 types of laboratories or testing settings, wherein you have a specialty laboratory which will be having only esoteric testing, that is very special testing, not the routine ones, where it will be done only in low volumes, and it doesn't run 24/7 because of the low sample volume or volume load. We run in batches or maybe weekly or 15 days once. But in the core laboratory, we have 24/7 facilities with the automated equipments, and ideally the turnaround time can be less than 4 hours. And there is a stat lab in all the hospitals where the turnaround time is expected to be less than 1 hour. And coming to the point of care testing, the patient and the doctor expects the results within 15 minutes. So this is the ideal setting for POCT. So if we see the settings and the complexities of the tests involved, we can see the professional setting. Core laboratory requires a professional setting, and the operators should be traditional and they should be trained, well trained and skilled. Whereas if we move on towards the POCT testing, it is non-professional. Anybody who is a non-laboratory related personnel can take up this testing, and it does not require particular skills or the conventional qualifications. But today, if we have to bring the POCT under a successful POCT program or controlled one, which is actually an out of control procedure, but we have to control the out of control testing. So for this, what are the ideal settings? So the advantages of POCT devices are they are very easy to handle. Anybody can handle the device. You don't have to have a particular training or the certification, and the rapid turnaround time. So the applicable settings for POCT will be in the hospital bedside, in emergency, ICUs, NICU, MICU, then in all the hospital units. So these are the settings which can be controlled, which are in our control. Whereas there are other settings which are out of control, that is some POCT testing done in clinics or at home. So I just highlighted in red because these two we cannot control and we cannot bring it under the ideal POCT program. So the common application or the devices what we are seeing is for the glucometers for glucose testing, or urinalysis, or ABG, or coagulation studies, rapid bacterial strips, or cardiac biomarkers, etc. So there were potential disadvantages by using POCT because the hospital settings feel that there is a lot of costing involved, and if you see, there should be a dedicated personnel, and 24/7 they are not able to report on the POCT, and the clinicians feel that the reports generated are not authentic and it's not reliable. So these are the potential disadvantages what we have. So today's talk will be basically what is an ideal POCT program. So the ideal POCT program for a hospital should be a collaboration between the core laboratory, the nursing services, and the clinicians. So all the three put together, they have to come under a common ceiling. They should form one committee, so which is in abroad they do as a POC steering committee. So a committee is constituted representing all these sectors, along with say allied, support departments like logistics, purchase, then quality department, then you have nursing. Everybody will be representatives of this POC steering committee. So they should ideally use the clinically relevant analysis or the testing, which will require an urgent action for a therapeutic procedure by the clinician. So the particular attention must be paid for the pros and cons of POCT, whether it is ideal to have a POCT in respective hospitals. So all the tests performed, as I said, will be coming under the ceiling of POC steering committee. So the committee will review, whenever there is a proposal for a POCT, it has to review what is the purpose of the POCT, whether you want to reduce the turnaround time, whether you want to have a patient compliance, or shorter duration of patient stay, or is it economically feasible. All these things they just have to look into. Then the volume, whether there will be a continuous high volume of the particular test or requests, and the costs involved, including the training the manpower, as well as costs involved in procuring the equipment, reagents, maintenance, and storage. Everything is involved in this. Then the methodology, whether the method is a validated method, whether you can maintain the precision, accuracy, and you can maintain the quality. Everything has to be looked into by the POC steering committee, and the reporting procedure as well. And it has to have an web-based or conventional training program for the POCT staff who can handle the POCT testing. And it can have, the program agenda can be based on these particular factors like method evaluation, POCT manpower allocation with training. So it depends on your setting in your hospital, how you want to allocate the manpower. You can have a trained staff like technicians or the nurses or anybody, any healthcare staff. And the person who is testing should have a color vision assessment as well, because that is very essential. Then the inventory management, so the purchase department can be brought into the steering committee. Then the quality control, what will be your IQC protocols, what will be your, if there are any proficiency testing available. Then the follow-up protocols. So coming to the role of medical lab, what the medical lab can do for POCT testing. So they can help in selection and introduction of particular POCT point of care testing menu, as well as selection of the devices. Then reviewing the feasibility, ease of use, everything. then they have to define what are the POCT testing we are going to start in our hospital. Then what will be the standard operating procedures or documenting the processes of the POCT. Then developing a standardized format for reporting. So they have to evolve procedures, who is going to validate the report and how it will be delivered to the clinician and how the clinician will be acting based on the report. And ensuring the traceability of the result. The data backup is very essential. Any point of time, if a patient or any other clinician wants a backdated result, you should be able to retrieve it. Then the service and maintenance of POCT devices. So you have to have a planned AMC or preventive maintenance program for the POCT devices. Then ensuring the safety, legal and normative requirements to be fulfilled. And also training the laboratory, non-laboratory technical personnel to perform POCT and handle the POCT devices. The equipment maintenance must be taken care, and even if the sterilization of the equipment if necessary. And very important is biomedical waste disposal of the test as well as the reagents and consumables which are used for POCT. So ideally a station, POCT station should have at least a list of persons who is handling the POCT testing. There should be an accurate description of the method and approach for the test. The documentation of all the events like calibrations, QCs, testing, results, everything should be available at the POCT station. So we have discussed about ideal POCT program, how to make it successful. So a successful POCT program depends on the continuous quality assurance and continual improvement program by the core laboratory. So you can have your own protocols for IQC or EQUAS or quality assurance, how you want to make it in your hospital. So it all depends on your settings. And there should be a regular periodic competency assessment for all the laboratory, non-laboratory technicians or the personnel who are handling the POCT devices, and ensuring that the protocols what is following is correct and he is adequately knowledgeable as well as skillful. The POCT steering committee should meet regularly at regular frequency, and they should review, implement and improve the existing quality procedures. So now coming to managing a successful POCT program. So some of the visions what I have just put for managing a successful POCT program is through the laboratory. So the laboratory shall continue this POC quality assurance and ensure compliance with good laboratory practices. The laboratory shall be mailing a point of care customer satisfaction survey. So you should have a customer satisfaction, both the internal customers as well as the external customers, to know where we stand. All the sites, and then laboratory shall continue to pursue the state-of-the-art POCT devices whenever there is an opportunity, and introduce a lot of test menu which can rapidly give you the result and the clinician will be benefited out of it. The laboratory shall also continue to optimize the electronic data management for POCT testing, and also they have to record all the non-conformances which are arising during the testing, and they have to act based on the whatever corrective or preventive action what you want to take, and you have to assess the effectiveness of the improvement program. The laboratory shall finally ensure the patient satisfaction and the patient safety at all times. Thank you.
Okay, thank you, Suresh. Thank for very nicely elaborated future of laboratory medicine, the point of care.